Hi, this is Dr. Aldo Espinosa, and today I'm going to show you the 5 tough questions that you should ask your dental implant provider before committing to your all-on-4 treatment. Question number 1, how many all-on-4s have you done in your career? Now, be really careful. Don't let your provider give you vague answers like, oh, I've been doing this for 20 years. That's a red flag. It's okay if you've been doing this for 20 years. It's big difference between doing implants, single implants or regular teeth implants than an actual all-on-4 procedure. Remember, experience matters. Question number 2, will I be getting same day permanent teeth with my implants the day of the surgery? A lot of providers will do your surgery, will place some implants, but will send you home with sometimes no teeth, sometimes removable teeth like dentures. Now remember, don't let your provider tell you, oh yeah, you will be getting teeth. Red flag. Teeth is not the same as permanent teeth or attached teeth to my implants, something that won't need to take in and out throughout the day. Question number 3. Now let's pay really good attention on the way your provider responds in your consult when you ask this tough question. What happens if something fails on my treatment? What happens if an implant fails, or what happens if my teeth fails? If your provider answers, oh, no worry, nothing ever fails, that's a big red flag. Any provider that's been doing this for many years and have done many cases, thousands of cases, that has the experience, knows that eventually when you do so many cases, something will fail. But the most important thing for you is to get a real straight answer on how will that person or how will that office handle if something fails on you. Question number 4, will everything be done by the same person? Sometimes you can get somebody doing your surgery, somebody doing your teeth, somebody else doing something else, and at the end of the day, you don't even know who is in charge and who is responsible for your treatment. You should ask your provider or the office that you're going to, will everything be done here in the same place? Will I need to go somewhere else to do some treatment? Will I be seeing some other people? And don't be also afraid to ask, is everything going to be done in the same place? Who is going to be doing my treatment? Who is actually going to be my doctor? And if that doctor is the one person that is going to take care of you from the start of your treatment all the way to finishing your treatment without you needing to see other people or needing to go to other offices outside the same location when you end up really not knowing who's in charge of you. And last but not least, question number 5. You should ask your provider, what material will my final teeth be made out of? Will it be zirconia teeth? Will it be acrylic or plastic teeth? Will it be some kind of porcelain teeth or some other type of material that is out there in the market that you don't really know? Pay close attention. Don't let your provider tell you, oh, you're going to get the best material. That's a red flag. You don't even know what's the best material. Just make sure that you get the answer. It's a straight answer. It's really easy to do. So just make sure that you get, is it going to be zirconia, acrylic, plastic, porcelain, or whatever tons of material are out there. And if you want to follow up on that, you can also ask where and who is going to be doing or manufacturing my teeth. Are your teeth manufactured in your same facility, or are you outsourced to some kind of lab, which is okay if the lab is reputable. So if the provider tells you that they manufacture everything in-house, well, that's great. They have everything controlled and probably they're top-notch technology. Now, if your provider tells you, well, we send to a lab, that's also not a bad thing. That's okay. They lose a little bit of control. But you can also ask, well, who is the lab that you send out to? Again, don't let your provider say, well, it's just the best lab. Just ask them to tell you the lab. They should. Last thing that you want to do is for your teeth, and unfortunately it happens to end up being doing outsource any other country, that probably you won't be getting the best quality that you deserve or you're paying for. So I hope that helps. those are 5 tough questions. And if you have any concerns, any question for me or anything, reach out, send us social media, send us a message. I'm pretty comfortable answering anything that anybody wants to know. Thank you.